Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, as part of our election series, Stephanie Desmond talks to Dr. Paul Spiegel, director of the Johns Hopkins Center for Humanitarian Health, and to Catherine Narvaez, an MPH MBA student and DACA recipient from Guatemala. They talk about what's at stake in the election when it comes to immigration. Let's listen.
Catherine Narvaez and Paul Spiegel, thanks so much for joining me.
Thank you for having us.
Pleasure.
So, Catherine, we're going to talk today about what's at stake with the election and immigration. And I'd like to start with you. We're going to talk about DACA. If you could remind us what it is and where we are, and tell us your story about DACA.
Yeah, sure. First of all, thank you for having me. I'm currently a second-year student at Johns Hopkins as a summer fellow. And I think one of the things that I always like to start off with is the fact that I am able to be a summer fellow because of DACA. DACA has given me the opportunity to pursue higher education, be able to work, do research, be able to drive freely. And I think a lot of the times we don't realize just the amount of opportunities that are open to us for just having a Social Security. I would like to remind people that DACA is not a status, it's just deferment from deportation, which means that at any moment it can be taken away from us, which means that if it was rescinded, for example, next month, I could potentially be deportable, and ICE or immigration has all our information. And they have came out before saying that if DACA is rescinded, they would deport Dreamers or DACA recipients. And so, there's a lot more at stake than just the fact that we would lose opportunities. We would potentially be at risk of deportation and family separation. Every time we renew our DACA, we provide the government with all our information, where we are, where we're studying, where we live, who our parents are, where we've worked, and they have access to all that information. And so there's a lot at stake, especially because looking at data now, you see that over 200,000 US-born kids are actually who have a parent who is a DACA recipient and are part of mixed status families. And so this is just another way of potential family separation and the continuous attack on immigrant communities.
So you were born in Guatemala and you came to the United States when you were 6?
Yes. So I was born in Guatemala, and due to economic drought and lack of opportunities, my mother decided that it would be better to migrate north. And my journey is a little unique because we spent a lot of time traveling through Mexico by foot, by bus, from town to town, church to church, asking for shelter, for food. And when we made it to the border, literally, I remember being 7 years old and walking through the desert and swimming across the river. And a lot of people try to vilify our parents for risking our lives to take that journey. But, migration, nobody wakes up and says, I'm going to put my kids at risk if there's not something better in the future in store for them. And so I think that the fact that our parents choose to migrate and take that journey north and put us, through just all these circumstances is an act of love. And I anytime that we see anything in Congress that tries to vilify our parents, we try to stray away from that because our parents are not criminals. And we don't want our parents to be vilified for the decision that they made to bring us to the United States. I mean, they are the original dreamers. They had better things. They had better opportunity. They wanted better opportunities for us. And so, yeah.
And this administration would like to send people like you back. Is that right?
Yeah. And I'm really thankful because I started realizing just how important education has been for me. Even though we crossed the border and I got stopped when we were going from Brownsville, Texas to Houston, and I actually spent some time in detention when I was 7. And so, now that I am in like higher ed and I've had the opportunity to do research, I think my voice has been amplified, and I am able to advocate better for kids who are going through detention, who continuously live what I would like to call a nightmare, because there's so much uncertainty and you literally live your life on a whim. You don't know if tomorrow you're going to be here. You don't know if tomorrow you're going to have a pathway to citizenship. And so it's just like trying to plan your life for what's unexpected is really hard too.
So, Paul, we've all seen pictures of detained children. That has been a policy of this administration to separate children and their families. Is that something that would change potentially with an election?
Potentially, yes. I actually, firstly, thank you for having me. And I want to just mention Catherine is one of my students, and what she and other DACA recipients bring both to the United States and the school, the other students, is invaluable. It's just one example of how migration, which is natural and happens everywhere, is a benefit to the U.S. And before I answer your question, I want to say that migration. Well, firstly, thank you, Catherine, because what you do
what a story
with us it's quite extraordinary. But there is a tremendous amount of misinformation about migration and refugees and asylum seeking. So perhaps there have been enough studies that clearly show that migrants, in those we artificially divide sometimes migrants into economic migrants who are documented and undocumented, and then asylum seekers and refugees who are fleeing a country due to persecution or violence. But what's interesting is, regardless of that status, there are enough studies that clearly show that migrants and refugees actually add to the U.S. economy. They're a plus; they don't take. But there's a tremendous amount of misinformation about that. And then the second misinformation that, and really sometimes it's still very deliberate, are that migrants and asylum seekers and refugees are not a security threat or even a terrorism threat as they can be portrayed to be. The numbers clearly show that in the U.S., it really is domestic terrorism that has been the largest problem, and migrants and refugees are not security risks. Maybe just to start with that, and then to say that migration is a very tricky issue. There isn't a right or wrong on both sides, but there are some moral and ethical issues that do need to be considered when migration policy is being considered.
Mm-hmm. We're seeing some differences, I think, between the candidates on refugee policy and on the borders. Could you talk to us a little bit, Paul, about that?
Sure. Certainly, the voters are able to see a very stark difference between what the Trump administration and a potential Biden administration are proposing. The Trump administration has been openly anti-migrant and anti-refugee, and so they have taken very strict. They have implemented a lot of rules to try to reduce migration and refugees. So, for example, on September 30th, just a couple of weeks ago from when we're speaking today, but on September 30th, the Trump administration has proposed to reduce the number of refugees that can be admitted to the U.S. To the lowest level ever, which would be 15,000. Conversely, Vice President Biden has proposed to actually increase that number to 125,000 refugees. These are refugees that are often resettled from other countries. And just to say that number compared to over 24 million refugees globally is a pittance. And the reason why it's so important, though, to do that is because this is one way amongst many others that the U.S. can show that they're taking care of their part when most refugees globally are not in the West, but they're in middle income countries that are right beside those areas where there is war. And then finally, the other bigger issue, I think, though, is that the current administration has used COVID-19 and the pandemic to put in rules that have dramatically reduced migration to this country, particularly across the southern border. And Joe Biden would try to, so at least he's proposing to reduce those rules significantly. And from an evidence-based point of view, one of the concerns that we have is that some of these rules, there was a March rule by CDC, and then there's a proposed future rule. And what they're proposing is to reduce migration only amongst migrants. Well, a lot of other people, American citizens, green card holders, and commercial traffic are occurring. So it's really not based on a public health view. It's not going to actually help to reduce COVID in this in the U.S., but it's rather based on a goal, which is to reduce migration and refugees to this country.
Mm-hmm. I also know that this administration has proposed, or actually maybe has accomplished, they've taken away protected status from several countries. Folks have been living in this country for many, many years, and now the current administration has worked to try to revoke that status. Can you talk to us just a little bit about that?
Catherine, do you want to start on that for me?
Yeah, so there's a couple of countries that have what's called TPS, or temporary protected status. And, you know, a lot of the times it's, I know Central America, a couple of countries in Central America have had protection. And what is potentially dangerous about this is the fact that these have been in place for a very long time. And so people have built their homes here. People have built their entire lives here. And you are abruptly telling them that, well, too bad. Now you have to go back to your home country. And so you know, kids who are, it's just another way for family separation. And like I said before, you know, a lot of families are mixed status families. And so potentially, whether it's TPS or DACA, you're basically doing the same thing. You're uprooting families and separating them. And so the ones that are disproportionately affected are kids, and who most are U.S. citizens.
Yeah, and I would just add, it's difficult. So when you have TPS, for example, Haiti is one amongst others, and one has to think about the law, or what is the current law, and what has been the past law to allow these people to come, and then look at who these people are and what they've done for the country. And so this is a very, very thorny issue, and some people do argue, but I, on a personal level, would not argue to say we should have open borders. And I think there needs to be some control of borders. But one has to think about a difference between what is happening now and letting people in or not according to the legal issues. And then looking at people like Catherine and others that have spent most of their lives here, and then making decisions that may be taken more on an ideological basis than actually what may be best for the children and the country economically.
I want to thank you both for joining me. Catherine, your story is incredible and very inspiring. And Paul, thank you for helping us through the policies. I really appreciate it.
Pleasure. Thank you.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.